गुड इवनिंग, खुशामदीद, नमस्ते। मैं आपकी होस्ट और दोस्त डॉक्टर विनी कांट्रू। मैं एक पल्मोनरी क्रिटिकल केयर स्लीप मेडिसिन स्पेशलिस्ट हूँ इंद्रप्रस्थ अपोलो हॉस्पिटल्स नई दिल्ली में। आज फिर से हम आपके सामने डॉक्टर केके's मेड टॉक्स का एक और बहुत ही अच्छा एपिसोड लेके प्रस्तुत हुए हैं थर्सडेज विद डॉक्टर विनी कांट्रू में, और ये हमारा 1010th एपिसोड है। This is a very good number which we have been looking forward to, and we continue to strive hard to get another and another, yet another episode of very good talk show of ours in front of you, which is related to medical information, relevant medical information, which is very, very useful for the community. So, आज के दिन भी हम ये चाहते हैं कि आपकी नॉलेज और बढ़ाई जाए। पहले चलते हैं हेडलाइंस ऑफ द डे पे। आज की हमारी हेडलाइंस क्या है? हमारी हेडलाइंस है रेनी सीजन के बारे में है। जी हाँ, बेंगलुरु प्री मॉनसून रेन, waterlogging, raising dangers of multiple ailments. We all know how the rainy season brings its kind of accompaniments with it. With waterlogging everywhere, we do get problems in traffic, managing our time, and yet, of course, many kinds of diseases which become very, very important during this season, which are certain vector-borne diseases as well as respiratory ailments. Doctors sound alarm as viral fevers surge in Hyderabad. In Delhi also, we have seen, sporadic cases of viral fevers coming into us. But the good thing is these were all very, very mild kind of infections, and people got better within a week. Yes, of course, post-viral tussiveness or cough and weakness is there, which remains for about 4 to 5 days after you get better, but that is not a major concern as of now. Unusual weather causes change in the infection patterns, which is being seen by many of the experts in various streams of medicine. We have been seeing that the infectious diseases are also on the rise due to many, many number of reasons. We are into global warming that is causing a lot of problems in terms of extreme weather conditions, decreased immunity and coping mechanisms inside the body, and overcrowding, which hampers the hygiene conditions, also leading on to this kind of surge in the infections. Surge in long lasting monsoon infections among Mumbai's children. So, we are seeing this news coming in from every corner of the country that there has been a surge in the infection, whether that is adults or that they are children as far as the age group is concerned. Chennai sees rise in flu and diarrhea cases due to sporadic rains and water contamination. तो यही बात हो रही थी कि इस सीजन में जो रेनी सीजन है उसमें वेक्टर बॉर्न डिजीजेस बढ़ जाते हैं, और इसी के साथ साथ जो अपर रेस्पिरेटरी इन्फेक्शंस हैं, फ्लू लाइक इलनेसेस हैं, एलर्जिक कंडीशंस हैं हमारे रेस्पिरेटरी सिम्टम की या रेस्पिरेटरी सिस्टम की, वो भी बढ़ जाती हैं कहीं ना कहीं। अब चलते हैं हमारे आज के टॉपिक ऑफ द डे पे। आज का हमारा टॉपिक बहुत ही इंटरेस्टिंग है। ये रेनी सीजन से रिलेटेड है, क्योंकि रेनी सीजन है तो हमारा टॉपिक है रेनी सीजन कफ, कोल्ड एंड थ्रोट इन्फेक्शंस। So for this very interesting topic, I'm going to call upon today a very, very good friend and a very distinguished medical professional, Dr. Vijay Warad.
Namaste. Namaste, madam.
Good evening, Dr. Warad, and we welcome you again to this platform where we will be discussing this very important topic. Let me put some light on the illustrious career of Dr. Vijay Warad. He is a Pune-based professional specializing in wide array of fields, including asthma and allergy, especially the pediatric allergies, neonatology, allergy and immunology, pediatric pulmonology, and many more. With over 23 years of experience, he offers comprehensive care at Sai Allergy Asthma Eye Hospital Clinic. Dr. Warad holds esteemed qualifications of MBBS, MD, showcasing his expertise in various subspecialties like pediatric clinical and lab immunology, clinical genetics, adolescent medicine, and child and adolescent psychiatry. Renowned for his dedication to patient education and high quality healthcare, Dr. Warad remains committed to delivering the latest and best medical services to his patients. So, very warm welcome, sir, to this platform.
Thank you, Dr. Viny, ma'am. Thank you.
So we are going to discuss about rainy season and what it brings along with it. In addition to the rainy season songs, which we are all very fond of, and whether it is our evening tea in front of the rain or our coffee, which is very essential in this season, we do see a surge in some of the respiratory infections, which are upper respiratory infections. Do you agree, sir?
Yes, ma'am. Absolutely. Actually, as this season is very refreshing and the rains bring up so many cheerful life in our way, and we always like to have a hot food and hot tea, coffee. But along with that, many times we have seen the upsurge into the cough, cold infections. It may be the waterborne infections and respiratory infections. And specifically, changing scenario, the respiratory infections are increasing. And specifically in Pune, last 3 days, there is a lot of rains, and we are seeing a lot of cough, cold, fever, such type of viral infections and allergic cases also. Not only upper respiratory, even some of the infections, the lower respiratory infections also, we see upsurge in the pneumonia cases also now. So that's true. Like along with the rains, some diseases also come in.
Yes, sir. So we are talking about different seasons here. Earlier, we used to say pneumonia and flu-like illnesses do come in the winter season when it is very cold. So, is there a change in certain of the characteristics of the virus, or do we see these surges quite often previously also? Is there something new in the epidemiology of these viruses, or something inside of us has changed? And many number of times we have seen even healthcare experts talking about pre-covid and post-covid era. So what do you think, that is there a change in pre-covid and post-covid era in terms of the viral infections?
Yes, ma'am. Actually, pre-COVID and post-COVID. Post-COVID, a lot of viral infections have changed. And specifically, the inflammatory viruses. Not only during the COVID, a lot of people used to have a loss of smell and all, but now also we are seeing patients with viral infections and which are having a throat problem and even the smell also. Some people have a foul smell also. So there are some viruses they have been changed, and the newer epidemic of these viruses, like specifically now recently we have seen in pneumococcal, like PPSV 23 valent vaccine has been launched in India. Why? Because beyond the 13 valent, they are not having that much protection. So the newer viruses are coming up. The same way, we may see the upsurge in the other adenoviral infections because recently, just few months back, there was a severe conjunctivitis epidemic in that the adenoviral infections were seen. The same way, respiratory viral infections. Now, as we will study the throat swabs and all, we will know about that. But definitely, the cough or cold or the sinusitis, which is not going away so easily. A lot of patients are complaining once they have a viral infection. Post viral, the inflammation is not going and they're having a lot of problem. So these cases are definitely increased.
Yes, sir. So, how do we differentiate between different kinds of infections? Because we do see in our country, we are the diabetic capital of the world, so to say. So, especially the diabetic population and those who are more than 60 years of age are very vulnerable to these kind of infections. And also on the other extreme, we have children who are very vulnerable. So, how do we differentiate between different sets of viral or bacterial infections? What a common person has to know, and when they should report to their doctor?
Very good question, ma'am. Actually, the children and the elderly people are always prone for the severe infections because naturally their immunity is low. As the child, their immunity is developing. Second, elderly, their immunity goes down. And again, in the adults specifically, the elderly people, they have comorbid conditions like diabetes and blood pressure and all. So those people again are more prone for the severe infections. Now, common cold, like whatever the people talk, it is a viral flu-like symptoms, and the common viruses, which are like a influenza, para-influenza, though are not much serious or something, they will be lasting for only 3 to 5 days or 7 days maximum. And generally, the peak is within 2 or 2 to 3 days, and then it goes down. But symptomatically, the patient may have some body ache or some headaches or some loose motions or throat problems, and then it goes away and he is better. But some of the patients, when the severe spikes of the fever are more, or they have a severe cough, and they are having a systemic symptoms like weakness is very severe, or uh, because of the fever, the high grade fever, their altered sensorium or something, then these patients can have a very severe infection. When in the throat, they will have a severe difficulty, maybe a tonsillitis, as well as swallowing difficulties there. Or maybe suppose they have a severe cough and respiratory distress. Suppose they have a breathing difficulty, then these are the severe infections. And they has to be differentiated from a common viral infections and serious viral infection. Then a common viral infections, it has a multiple symptoms at a one time. And suppose it is a bacterial infection, the patient may have a localized infection somewhere, and the fever will be persistent. It will not resolve with an antipyretic and the routine conservative medications. The fever will continue severe. And generally, these viral infections, if it is a bacterial, they will be involving some or the other part. It will not be a systemic symptoms will be there. Systemic symptoms are lesser. The fever is more predominant in the bacterial infections. Then we have to always clinically examine carefully any focus of anything anywhere in the tonsillar fossa or sinusitis or otitis, any middle ear infections are associated with that. And we have to treat with the proper antibiotic also. So we have to differentiate that way, like is it a viral or bacterial? Most of the time, viral infection, not only the respiratory, even the patient have a nausea along with vomiting. So the GIT also may be involved that type, or some viral rashes can be there in the body. But the bacterial infection will be localized one. Now, again, there are some other like severe type of adenoviral, mycoplasmal, chlamydial infections and all. Those are lesser, but if the patient has a atypical presentation and severity of the symptoms are there, then we have to see for those also, because we have to treat accordingly. Like specific medications should be given. Now, besides the common cold, if it is persist for a longer period, the fever goes away, and if the whatever the symptoms persist, then underlying there can be the allergy, and which is triggered by the viral infection. The infection goes away, but the inflammation which is persistent, it always continues. So the underlying disease also has to be managed properly. So that way we have to differentiate these patients.
Right, sir. Very well explained. So we do see a surge in the winter infections. In addition, we see a rainy season wherein we do get upper respiratory infections, we get certain vector-borne diseases, we get diarrheal diseases. That is what we are discussing today here for those who have joined in late for this presentation today. So we have Dr. Vijay Warad from Pune. He's a very, very renowned pulmonologist, especially dealing with child pulmonology cases. So he is increasing our knowledge about this ailments, which is very, very common in the rainy season. So we talked about how do we differentiate between different kind of viral infections, whether it is severe or mild, and when we should seek medical attention, especially if we have severe symptoms. Then we should not be sitting at home and trying to convince ourselves that we will be getting home. It's always better to get yourselves checked from your doctor who is nearby. Sir, which are the common tests which are ordered for these kind of patients, and when they need to be admitted to the hospital? So this is very, very important in our country, because a lot of the times patients are very, very reluctant to get admitted to the hospital when they are advised at the right point in time. And later on, when there is deterioration in terms of ARDS, for example, then it becomes a little late for them to get better. So it's very, very important for everyone to understand that why is admission in an hospital important. So let's throw some light on this.
Yes, ma'am. Actually, that's very important because once the infection spreads more, and it becomes like septicemia can be there, the whole body, or it can be localized to one part of the lungs and pneumonia or some pus infections, or it even from here it is connected to the brain
Brain.
also, from the nose, nasopharynx, and the cribriform plate. There are, and the infection can ascend over there, specifically in children and elderly, and it can lead to the severe meningitis also. So the patient should be careful. Suppose a common viral infection is there, and as I said, if it is localized something and the common symptoms are there, slight weakness, fever is there, not going above 103 and all, and patient after 1 or 2 to 3 days, there should be the decline into the fever. Suppose it is continuously high, then it is worrisome. They have to rush to the doctor. So after 3 days, if the fever persists, it is always better to rush to the doctor, or even within 3 days, if the fever is very high grade and it is continuously spiking, then they have to rush to the doctor. Then second is that tachypnea, like respiratory rate is more. So the because of the fever also there is some increase in the respiratory rate, but specifically in adults we say above 40 respiratory rate is significant. It may be some severe infection into the chest or something. We have to see. Then again there are some viral infections. They really cause a croup-like condition. So they are called a laryngitis. So there is a vocal cord like the swaragranthi we call it, the vocal, we talk about that. And then if there is a severe infection over here, it can cause a very severe life-threatening complication also. So
Especially in children.
significantly, stridor is there, and if they feel like there is some problem in the while sleeping, or the patient has a different type of sounds, very loud sounds, they have to rush to the doctor. They have to take a proper advice for that. Otherwise, they may have a problem. So that way, the respiratory rate also they should measure. And suppose the patient is having a difficulty in whatever the regular tasks. Suppose he's going to the toilet, he's taking a bath, he's walking something, and still he feels very exhaustive, and he will have like giddiness, or he requires a bed rest. Then it is also worrisome because he has to have an examination for that. So depending on that, some simple tests can be done. So generally within 3 days, we don't have much like investigations will not show anything in the blood. After 3 days only, most of the investigations they are picked up, like common complete blood count, and uh, any bacterial infection or something, neutrophils or lymphocytic predominance or something. Throat swab can be examined depending on the what type of symptoms are there. If it is a severe flu-like symptoms, then examine for the any influenza viruses, which type of. Now even in Pune, we have 1 or 2 COVID cases also admitted in the Sassoon hospital. So there are these diseases never go away. So never neglect them also. Ki like we are not investigating basically, but there can be a COVID still persistent in the community. So depending on some specific high risk patients, they have to be examined. And the usual normal persons like adolescents and young adults, they don't require many investigations. Specifically, children and the adults with the comorbid conditions, if there is an underlying severe allergy, tonsilloadenoitis, or somebody has a significant obstructive sleep apnea, or somebody has the blood pressure problem, hypertension, or uncontrolled diabetes, these people may have a severe descent of the infection to the lungs and may cause the problems. So these are high risk patients. They should always go to the expert doctor, and it's nothing harm in going to the doctor repeatedly also. It is more useful to the patient. So if they call after 24 hours, 48 hours, always go and have a checkup. If nothing is there, it's okay. But suppose the doctor feels if there is some problem, and the X-ray has to be done, or depending on the dehydration, many of the people have a dehydration. After the dehydration, the airway mucosa, the water is lost, and there can be a reverse bronchoconstriction and severe bronchitis also. So depending on that, suppose the patient is already having asthma, because the dehydration it may be triggered. So such some simple cases, there can be a requirement of the IV fluids, and some patients where after the blood investigations or throat swab or X-ray, some specific systemic antibiotics also has to be given through the IV intravenous cannula. So with the doctor's advice, in an early stage, if it is managed, it is much better, and the patient can recover very fast, rather than going into the late stage and leading to the respiratory distress syndrome and pneumonias and pleural effusion and systemic infections. Then it becomes more difficult, because still in India, in worldwide, the pneumonia deaths are very high amongst the developing countries. Even in the elderly also, the deaths because of the pneumonias in India are very high. So considering that, early interference is always better.
Right, sir. Very well said. So we have discussed about the rainy season common upper respiratory as well as lower respiratory tract infections and how they get increased during the rainy season. We have discussed about their symptomatology, when we have to be very very careful whether they are mild kind of symptoms, whether they are severe kind of symptoms, and when we should be seeking attention. So these have been very very well explained and taken care of. The normal investigations which we do order in terms of blood investigations and radiological investigations, which means the chest x-ray or the CT scan, depend upon the clinical condition of the patient. And of course, if you are in doubt, don't ever hesitate to visit your doctor, because it's always better to keep your threshold for visiting healthcare center very very low, and not think about the over investigations which may be happening, especially in diabetics, because in diabetics it's very important to know that infections can take a negative turn at any point in time because of the uncontrolled diabetes which they have. सो इन टर्म्स ऑफ ट्रीटमेंट सर, अगर हम ट्रीटमेंट की बात करें तो ये कॉमन इन्फेक्शंस जितने भी हैं, आप अपनी प्रैक्टिस में कॉमन इन्फेक्शंस जो हैं, व्हाट आर द कॉमन इन्फेक्शंस व्हिच यू सी currently in pediatric as well as adult age group, and what is the available treatment for all of these infections?
एक्चुअली अगर देखेंगे तो बेसिकली nowadays the infections are on the rise, but along with that recently some studies have been done, and even in the upper respiratory infections the underlying Th2 inflammation is there because of the pollutants, allergens and all, and a lot of underlying that allergy is the predominant. So the indoor pollutants, outdoor pollutants, then the grasses, pollens, then dust mites, they have increased a lot. Even recently, if you see, the India's population and pollution has crossed over the world, and the heat wave was more in the Indian scenario. So because of that, the dusts have increased a lot, and because of that again the pollens have been extended. So now previously we used to find up to February the pollen season, but this year the pollen season has been extended a lot. So because of the weather change, what happens ki, because of the breeze and the clouds happen, these dust particles and pollens are sucked toward the cloud, and as the lightning happens, these pollens are broken down in a very smaller pieces and they rush very fast into the airways. And that's why also many of the people have a cough cold. They feel like it is a viral infection always. And unnecessarily they go on taking antibiotics and all. It's not needed. If it is a viral infection, definitely there has to be a fever more than 100.4 degree Fahrenheit. So below that, if it is there, it can be the inflammation because of this change in the weather and all, because of the rain soaking, or that it just triggers it. So the common cold or like throat congestion, even the sinusitis, the ear problems or something, it also can be allergic, because specifically in children now it is a number one chronic disease. In adults also, every third person is suffering with some or the other allergies in Indian scenario. So considering that, so we should not always label as a viral infection also. If there is a significant fever more than 100.4, then it is a viral infection. Suppose most common in children, around 80 to 90% of the children have a viral infection. Adults maybe 50 to 60%, and remaining can be the bacterial infections. So depending on that, as we discuss about that, how persistent the fever will be there, the treatment depends on it. The common one is a homemade therapy. So whatever we say, people always go for that, like saltwater gargling, then some age-old practices like curcumin, then colostrum, such type of immunomodulators we can say. The people just go on taking that. Even they have so many herbs, kadas, and miri, and something they would go on doing it. But if, as we discussed, if the persistent fever is there and if the patient has a significant symptoms, weakness and all, then don't stay at home, visit to the doctor. And once the doctor examines, because see what happens in Indian scenario, the self medication is a very big problem. So suppose last year I have given some prescription to somebody and he had that results. That patient will go to the medical store and show the same file, and he starts taking the same medications. But each and every time the same infection may not be there. So always keep in the mind, people, like don't go and take those medicines. Always, each and every time there can be this different infection. Even not only last year, even 15 days back there can be a different infection. Now this can be different infection. So always, with the experts' advice, take some specific medications. And for the cold and all, they can have regular levocetirizine, or fexofenadine, such type of some anti-cold preparations. Children's below 12 years not to have a sedative medications because they will affect the sleep cycles and all. And the people which will be having in a driving or a high risk jobs at the heights and all, they should not have a first generation over the counters like chlorpheniramine maleate or pseudoephedrine and all, because they cause a sedation and the accident chances can be there. So if they want to have an anti-cold, they should have a safer medications, like its second generation we call it, like fexofenadine, bilastine, or levocetirizine and all. So non-sedative, non-blood-brain crossing medications. Suppose there is a mild cough and all. So depending on that, there are many medications available. So they can have, if there is a mild cough and salt water gargling, then paracetamol is the best antibiotic. Don't rush for the unnecessarily higher, like in Indian scenario, a lot of ibuprofen and mefenamic acids and all given. Even recently, there was an article mefenamic acid is not a good drug to be taken self-medicated. So paracetamol is the safe one for everybody. They should have. And suppose the patient is not responding to the paracetamol, always visit to the doctor, and the specific antiviral or specific antibiotic can be given. Like antiviral, there are uh, oseltamivir like medications are there. Then depending on other like and some antivirals are there that can be given. And antibiotic, so there are many one. So always never self-medicate. Take a advice of the doctor. And if it is not a viral infection, and if it is an allergy, as I mentioned, many of the people repeatedly they have, as the weather changes, they start having a cold, stuffy nose or rhinorrhea. It's not a watery, it is a sticky and like serosanguinous or mucus like mixed one. So always better to uh, treat the underlying cause also, and some simple precautions, whatever like the avoidance of these allergens and dusts and all, that is always preferred. And the nasal hygiene is very important. If the people start taking care of the nasal hygiene, most of the infections also can be managed and the allergies also can be managed.
Right, sir. So we have many people here connected with us. We have Ramesh Pal Singh Panwarji. He's saying good evening to you. And Ali Nazakat ji, good evening again. Anita Dadlani ji, good evening everyone. Bimla Kapoor ji, namaste aapko bhi. We have Dr. Sakshi Buddhi, who has raised a very good question. In fact, antibiotic stewardship is something which everybody is looking up to, and everyone is working towards it, so that we have some rational use of antibiotics happening. So she's asking how to curtail the irrational use of antibiotics, and even 50 to 60% of doctors, she thinks, in her opinion, that they are themselves advising antibiotics irrationally. So how to go about antibiotic stewardship?
Very good question. Actually, the जैसे always we say ना, जैसी प्रजा वैसा राजा, वैसी राजा वैसी प्रजा. The same way in Indian scenario, the people want immediate relief. That's very sad. So the people should have a patience, and the expert doctors will never give antibiotic haphazardly. So the whatever the qualified one, as I am saying, MBBS, MD, and they are the qualified people which can really prescribe the antibiotics. They have experience about that. So which one to be at? So they will never prescribe that easily. Only thing is that most of the time in our practice also we have seen people only force us, and they want to like immediate relief. So if it is a viral infection, if I am saying your child or you yourself will take 3 to 4 days, keep a patience, follow up with the doctor. Then I think very few expert doctors will give antibiotics. That's important. Second thing is that suppose we want to really reduce the antibiotics, the awareness is the most important thing in anything. So by both ways. So for the doctors already there are organizations like Indian Academy of Pediatrics, API, all organizations are doing a lot of work on that, and the rational use of antibiotics should be prescribed. And now this era, I have seen like very few doctors, the experts one, they don't write so easily. They always explain. So the time and the patience from the patients also is very important. Second thing is treat the underlying cause. As I mentioned, like whatever the things are there, like Th2 inflammation is very important. The real-time data has shown recently, like those patients which have a repeated throat tonsil adenoids, upper respiratory infections, and all, they have Th2 inflammation. So then there are some good immunomodulatory medications. So the people can be prepared before the rainy season, and they can have a very safe. Some molecules are there, some probiotics are also there, some uh, immunomodulatory like pitotimod and all. These molecules can be prepared for those people which are have a repeated respiratory infections. And this can be given for 2 months, so their effect can be up to 6 months. So depending on that. So before sleep also they can have a salt water gargling, have a proper hygiene, brush the teeth because suppose there are some uh, bacteria and all, they will cause infections. So such type of then some breathing exercises, they also very well help the people traditionally also, and it has been seen scientifically also. Such type of practices should be there, and some simple precautions also. As I mentioned, depending on the weather and all, cover, use the umbrellas, don't get soaked, and so each and every patient has its own tendency. So depending on that, the people should also take care. Nowadays, previously कैसा होता था कि लोग जो है सिर्फ समर में ही आइसक्रीम खाते थे। अभी कैसा है कि लोग कभी भी आइसक्रीम खा रहे हैं, तो इन्फेक्शन होने वाला ही, वेदर चेंज होने वाला है। तो लोगों को भी ये ध्यान में रहना चाहिए कि हमें कोई भी सीज़न में कोई भी चीज़ नहीं करनी चाहिए, डिपेंडिंग ऑन दैट, so they can prevent the infection. So this way, it has to be both hands, from the patient's perspective and from the doctor's perspective.
Most definitely, sir. Availability and the outreach of people with the pharma industry. I mean, every kind of medication is available just at the pharmacy desk. So you can yourself go to the pharmacy and have any kind of antibiotics, which is something wherein we should have certain kind of curbs from the government agencies. That is something which should be kept under curb, because anybody can go over the counter and buy these antibiotics. So that should also be taken into consideration, which is my opinion. So
Yes, ma'am.
yes, antibiotic stewardship is very very important. So I request each and every one who is connected to us through this session, you please type in your questions in the comment section, and we would take these questions as far as possible. We have had a very very good discussion about the infections which are very common in rainy season, especially the upper respiratory infections. सो वी डिड टॉक अबाउट प्रिवेंशन, यानी कि कैसे हम अपने आप को प्रिवेंट करें ये सब इन्फेक्शंस के लिए। उसमें बात आई कुछ मॉलिक्यूल्स की, कुछ नेचुरल एजेंट्स की, जिसमें कि काफ़ी एजेंट्स आते हैं, जिसमें हल्दी का हमारे जो जो हमारे जितने भी टेक्स्ट हैं प्रीवियस, उसमें काफ़ी अच्छा वर्णन है। और जितने भी विटामिन सी रिच फूड्स होते हैं जिसमें आंवला भी आता है, सॉरी, दे आर वेरी वेरी इंपॉर्टेंट। सो उसके बारे में भी हम बात करेंगे इन टर्म्स ऑफ प्रिवेंशन विच कैन बी हैड इन द टर्म्स ऑफ the various kind of food which we have. But on the other hand, we do have certain immunizations for viral infections, which are very important for all of us to know in terms of children and adults. So let's speak about that, sir.
Yes, it's a very nice, important thing because still the people just take whatever the available at the government hospital vaccinations. But some vaccines which are not available in the government setup, ये भी लोगों को लेना बहुत जरूरी है। स्पेसिफिकली बच्चों में अगर देखेंगे तो एच इन्फ्लुएंजा बी वैक्सीन बोल के होता है कि जिससे काफी लोगों को इन्फेक्शन होके कान के प्रॉब्लम्स होते हैं और मीनिंजाइटिस भी हो सकती है, तो वो प्रिवेंट करने के लिए वो कंपलसरी आज वो गवर्नमेंट में भी दिया जाता है। दैट्स अ गुड पार्ट। सेकंड जो है इन्फ्लुएंजा वैक्सीन बोल के, वो भी हर साल बदलते रहते हैं वर्ल्ड हेल्थ ऑर्गेनाइजेशन की गाइडलाइंस के हिसाब से। तो लोगों को फ्लू वैक्सीन हर साल लेना पड़ता है, उसका ईयरली एक डोज होता है। देन न्यूमोकोकल वैक्सीन, सो इन द चिल्ड्रंस ऑल्सो दे आर बीन गिवन, बट हार्डली 10 to 20% ऑफ द पॉपुलेशन, 80% ऑफ द पॉपुलेशन जो है अभी भी ये न्यूमोकोकल वैक्सीन नहीं लेते हैं, तो वो भी लेना बहुत जरूरी है लोगों को। और उसमें मैंने जैसे कहा कि 2 साल के ऊपर के लोगों के लिए अभी PPSV 23 बोल के 23 वैलेंट वैक्सीन आया है। वो छोटे बच्चों से लेके बड़ों तक, बड़ों में भी जेरियाट्रिक एज ग्रुप जो है 55 साल के ऊपर के लोगों को देना चाहिए। और जो लोगों को डायबिटीज, ब्लड प्रेशर या अस्थमा, क्रॉनिक रेस्पिरेटरी डिसीजेस, सीओपीडी है, उन लोगों को ऑब्स्ट्रक्टिव स्लीप एपनिया, कराटे जो लेते रहते हैं, तो उनको भी ये वैक्सीन देना जरूरी है। बड़ों को भी, ऐसे जो हाई रिस्क पेशेंट है इनमें भी इन्फ्लुएंजा वैक्सीन, फ्लू वैक्सीन भी देना बहुत जरूरी है। तो अभी एडल्ट वैक्सीन भी कंसेप्ट है अभी इंडिया में, और वो देने ही चाहिए क्योंकि दैट्स वेरी इंपॉर्टेंट। नॉट ओनली दैट, जो लोगों को मैंने अभी कहा कि ये जो कोमॉर्बिड कंडीशंस होते हैं, तो इनमें हर्पीज जोस्टर का भी वैक्सीन आया हुआ है, वो भी इन लोगों को लेना बहुत जरूरी है। ये रेस्पिरेटरी बहुत कम पेशेंट्स में उसके कॉम्प्लिकेशन होते हैं, काफी पेशेंट्स में नागिन जिसे बोलते हैं, जैसे कि स्किन का प्रॉब्लम होता है, लेकिन इट इज वेरी पेनफुल, तो वो भी वैक्सीन इन पेशेंट्स में लेना बहुत जरूरी है।
जी सर, बहुत बढ़िया तरीके से आपने समझाया कि किस तरह नए-नए वैक्सीन्स अवेलेबल हैं जो कि हेल्प करते हैं इस तरह की डिज़ीज़ेज़ में। जिसमें हर्पीज जोस्टर का जो वैक्सीन है, वो आपके जो पोस्ट हर्पिटिक न्यूरैल्जिया है, यानी कि जो पेन होता है आपको हर्पीज के लीजन्स के बाद, उसमें भी काफ़ी कमी करता है। तो ये हमें ध्यान में रखना चाहिए, क्योंकि ये पेन बहुत ही एक्सक्रूशिएटिंग होता है। ये पेन इतना गहरा होता है, इतनी देर तक रह सकता है, पूरे आजीवन आपको तंग कर सकता है। तो ये भी इम्पोर्टेंट है कि हम इन चीज़ों का ध्यान रखें, क्योंकि पेन एक ऐसा सिम्टम है जो आपकी कोमॉर्बिडिटीज़ को काफ़ी बढ़ा देता है, आपकी लाइफ को आप हैप्पीनेस छीनने वाला एक चीज़ है, जिसको कि ध्यान में रखना चाहिए। हमारे साथ विनायक शर्मा जी हैं, गुड इवनिंग बोल रहे हैं। विशाल कुमार जी हैं, जिनके कुछ सवाल भी हैं। वो जानना चाहते हैं कि ऐसा है कि जब भी हमें इन्फेक्शन होती है अपर रेस्पिरेटरी ट्रैक की, जैसे एक्यूट फेरिंजाइटिस होती है, तो कई बार ऐसा होता है कि सिंपल पैरासीटामोल या जो डिकंजेसेंट्स है, उससे वो रिलीव नहीं हो पाती, और हम लोग देखते हैं कि जब हम एजिथ्रोमाइसिन लेते हैं 3 दिन के लिए, तो कई बार इम्प्रूव कर जाती है, विच इज़ कोइंसाइडिंग विद द डे नंबर ऑफ डेज for which the viral infections remain symptomatic actually. और वो ये जानना चाहते हैं कि वायरल और बैक्टीरियल अपर रेस्पिरेटरी ट्रैक्ट इन्फेक्शंस में किस तरीके से प्रिसाइसली हम डिफरेंशिएट करें, ताकि हम एंटीबायोटिक का यूज जो है वो कम कर पाए।
एक्चुअली बहुत अच्छा प्रश्न है। जैसे हमने ऑलरेडी इसके ऊपर डिस्कस किया था कि अगर जब वायरल होता है तो सिर्फ वो थ्रोट में भी फेरिंजाइटिस रहेगा, तो सिर्फ वहाँ पे पेन या नहीं रहता है, उसके साथ में पेशेंट्स को छींके आना, कोल्ड या थोड़ा बहुत साइनोसाइटिस। तो वायरल में मल्टीपल ऑर्गन्स इन्वॉल्व होते हैं जनरली, और उसमें थोड़ा बहुत वीकनेस भी इमीडिएटली चालू हो जाता है उसी के दिन में, या कुछ और भी जीआई सिम्टम्स भी होते सकते हैं, नॉसिया हो सकता है या एक आधी लूज मोशंस। जब बैक्टीरियल है तो वो लोकलाइज रहता है, सिर्फ वो फेरिंजाइटिस ही हो सकता है। अभी इसमें प्रैक्टिकली जो है ना, आपको डिसाइड करना बहुत डिफिकल्ट है। डॉक्टर ही जो है स्पैचुला टंग डिप्रेशन करके अंदर चेक करके देख सकते हैं, और वही डिसाइड कर सकते हैं कि ये वायरल है कि बैक्टीरियल है। नहीं तो पहले 2-3 दिन में डिफरेंशिएट करना डिफिकल्ट होता है। हाँ, लेकिन अगर फीवर परसिस्टेंट है और स्पाइक्स कंटिन्यू आ रहे हैं और वो कम नहीं हो रहा है, तो इसके बैक्टीरियल चांसेस ज़्यादा रहते हैं। लेकिन तभी भी फिर भी खुद होके एजिथ्रोमाइसिन वगैरह नहीं लेना चाहिए, क्योंकि एक्चुअली ये एजिथ्रोमाइसिन जो मेडिसिन बनाई गई थी, वो एक्चुअली रेजिस्टेंट ट्यूबरकुलोसिस के लिए बनाई गई थी। वो कोई अपर रेस्पिरेटरी इन्फेक्शंस के लिए नहीं है। उसका यूज़ किया गया है और उसका ओवर यूज़ हो रहा है कम्युनिटी में। इट्स नॉट गुड दैट वे, क्योंकि ये कुछ रिजर्व्ड मेडिकेशंस है। जो कॉमन में दिया जाता है वो एमॉक्सिक्लेवोलिनिक बोल के एंटीबायोटिक होता है। वो भी जो है वो डिपेंड करता है कि कौन सा बैक्टीरियल इन्फेक्शन है, उसके हिसाब से देना बहुत जरूरी है।
जी सर। रामेश्वर सिंह जी अपना एक कमेंट कर रहे हैं कि स्टीम इनहेलेशन भी कई बार अच्छा साबित होता है, स्पेशली अडल्ट पेशेंट के लिए। क्या स्टीम इनहेलेशन बच्चों के लिए भी यूज कर सकते हैं, और डू वी हैव टू कीप सर्टेन थिंग्स इन माइंड व्हेन चिल्ड्रन आर कंसर्न्ड
One
इन
sec,
टर्म्स
ma'am.
ऑफ स्टीम
Somebody is
इनहेलेशन?
there. I will just one sec, one sec.
मैं आप सबसे ये रिक्वेस्ट करना चाहूँगी, यदि आपके कुछ और सवाल हैं तो आप प्लीज़ कमेंट सेक्शन में अपना सवाल डालिए। ये सारे सवाल मैं कोशिश करूँगी कि सर से पूछूँ। अभी हम जानना चाह रहे हैं कि क्या बच्चों के अंदर भी स्टीम इनहेलेशन प्रिस्क्राइब कर सकते हैं, या हमें बच्चों के मामले में कुछ कंसर्न्स रहते हैं?
हाँ, यस मैम। एक्चुअली स्टीम इनहेलेशन जो है वो, अगर सपोज देयर इज अ सिग्निफिकेंट स्टफी नोज या साइनस की अगर प्रॉब्लम है, और या कभी-कभी म्यूकस होता है, इट डजंट गेट अ रिलीफ, टेम्परेरीली यूज़ करना चाहिए, क्योंकि ओवर यूज़ ऑफ स्टीम आल्सो इज़ नॉट गुड। बच्चों को तो बहुत केयरफुल होना चाहिए, क्योंकि काफ़ी बार हमने देखा है कि बच्चों में स्टीम लेते हुए बर्निंग होती है, आँखों को भी, उसकी कॉर्निया या कंजंक्टिवा को भी डैमेज हो सकता है। ये देखा गया है, क्योंकि बच्चे कैन नॉट एक्सप्रेस द थिंग्स। तो इसलिए बच्चों में बहुत कम बार स्टीम देना चाहिए, एंड दैट आल्सो इफ इट डॉक्टर की सलाह से ही, एंड स्पेसिफिक सिचुएशन में, अदरवाइज रूटीनली नहीं है। और इवन बड़ों को भी जो है, डिपेंडिंग ऑन द, जब ज़रूरत है तभी लेना चाहिए। ओवर यूज़ इज़ नॉट गुड, क्योंकि इट विल अगेन डैमेज द नेचुरल बैक्टीरियल फ्लोरा, और उसकी वजह से सेकेंडरी फंगल इन्फेक्शंस और भी होने के चांसेस होते हैं। स्पेसिफिकली हमने कोविड में देखा है, इंडिया में सबसे ज़्यादा म्यूकोरमाइकोसिस जो हो गया था, तो उसमें वो भी एक रीज़न बताया गया है कि ओवर यूज़ ऑफ स्टीम। तो डॉक्टर की सलाह से ही, बच्चों के तो स्पेसिफिकली डॉक्टर की सलाह से ही देना चाहिए।
जी सर। सो विशाल कुमार जी भी अभी अपने सवाल पे कुछ कुछ कमेंट्स कर रहे हैं। वो कह रहे हैं फीवर, कफ, कोल्ड दोनों वायरल और बैक्टीरियल इन्फेक्शन में होता है, हम इन्फर नहीं कर पाते। सोर थ्रोट, फीवर, रनी नोज बैक्टीरियल वायरल दोनों में होता है। तो ऐसे में काफ़ी सारे एंसिलरी टेस्ट होते हैं विशाल, जो हमें हेल्प करते हैं दोनों में डिफ्रेंशिएट करने के लिए, क्योंकि पहले 3 दिन इनके सिम्टम्स ज़रूर एक जैसे होते हैं, लेकिन जैसे जैसे ये सिम्टम्स इवॉल्व होते हैं, स्पूटम के कलर से, आपका फीवर की इंटेंसिटी से, आपके कफ के कैरेक्टर से, या कुछ एंसिलरी टेस्ट जो कि सीबीसी हम कराते हैं, चेस्ट एक्सरे कराते हैं, उसमें किस तरह की ओपेसिटीज़ हैं या किस तरह का कलर आ रहा है आपका म्यूकस का, और जो स्पूटम के हम टेस्ट करते हैं जिसका एरोबिक कल्चर भी हम कराते हैं, उसके बेसिस पे कई बार हमें डिसाइड करना पड़ता है कि एंटीबायोटिक की ज़रूरत है। यहाँ बात हो रही है कि अपफ्रंट अगर कोई इन्फेक्शन है जिसमें आपके अपर रेस्पिरेटरी इन्फेक्शंस आ रहे हैं, तो पहले ही दिन पेशेंट जब ये सिम्टम आपके पास आते हैं, तो अपफ्रंट एंटीबायोटिक का इस्तेमाल करना एक सही तरीका नहीं है। सिम्टम्स को इवॉल्व करने दीजिए। यदि पेशेंट आपके स्टेबल हैं तो उनको मॉनिटर करिए, फॉलो अप में बुलाइए और ये सब एंसिलरी टेस्ट कराइए। आप ज़रूर जान पाएंगे कि बैक्टीरिया है या वायरस का इन्फेक्शन तंग कर रहा है। आज का हमारा सेशन काफ़ी अच्छा रहा सर। हमने जाना कि किस तरीके से वायरल इन्फेक्शन जो बहुत कॉमन होते हैं और पोस्ट जो कोविड एरा है उसमें बढ़ जाते हैं, उस समय पे किस तरह बार बार वो सिर उठाकर हमारे अंदर होते हैं, और पोस्ट कोविड एरा में ब्रोंकाइटिस भी कॉमनली होती है, जिसमें आपने काफ़ी अच्छे से समझाया कि हमारी जो इन्फ्लेमेशन लेवल है बॉडी में वो कई कारणों से बढ़ गई है। उसमें हमारा लाइफस्टाइल भी आता है, फूड के चेंजेस हैं, जो हम फूड खाते हैं या फूड चेन में इतनी सारी मिलावट है उसके कारण, या पोल्यूशन जो है उसके कारण भी हमारे बॉडी का रिएक्शन काफ़ी चेंज हो गया है। तो ब्रोंकाइटिस भी काफ़ी कॉमन हो गई है। इसके सिवा सर आप अगर और कुछ हमें बहुत ही अच्छा छोटे शब्दों में और समरी के तौर पे हमें अगर कुछ बताना चाहते हैं तो प्लीज़ बताइए, क्योंकि आज आपने एक बहुत ही अच्छा सेशन हमारे साथ शेयर किया है, जिसके लिए हम आपके सदैव आभारी रहेंगे।
थैंक यू मैम। एक्चुअली इसमें समराइज में यही कहना चाहूँगा कि जैसे हम हमारी कार या कोई बाइक है, अगर थोड़ी भी खरखर करती है तो हम उसे पहले ही तुरंत उसे रिपेयर करते हैं। तो लेकिन ये देखा गया है कि हमारी बॉडी को जो है, लोग बहुत जब तक ज़्यादा नहीं होता है तब तक डॉक्टर के पास नहीं जाते हैं, तो वो कोई सही बात नहीं है। लास्ट टाइम मुझे नॉर्मल 2-3 दिन में मैं ठीक हो गया था। इसका मतलब ये नहीं कि अगली बार वही इन्फेक्शन होगा या उसी तरह के ही सिम्पटम्स होंगे। हाँ, रेगुलर फिटनेस के लिए जो है, हम अच्छा खाना खाना ज़रूरी है, हमें हमारे सेहत का ध्यान रखना ज़रूरी है, फिर ब्रीथिंग एक्सरसाइज़ेस करनी ज़रूरी है। कुछ जो नेचुरल हमारे पास पहले से, जैसे आपने भी कहा था कि कुरकुमिन है, कोलोस्ट्रम बोल के, ऐसे जो मेडिकेशंस है, ऐसे रेनी सीजन में हम प्रिवेंटिव बोल के रेगुलर भी ले सकते हैं, सप्लीमेंट्स बोल के। वैसे ही जिंक, विटामिन डी, ये नेचुरल सप्लीमेंट्स जो है, आजकल विटामिन डी की भी कमी काफ़ी दिखी गई है, उसी की वजह से भी वायरल इन्फेक्शन का चांसेस ज़्यादा हो सकते हैं। तो एवरी 6 मंथ्स बड़ों या बच्चों में विटामिन डी रेगुलरली डॉक्टर की सलाह से भी लेना जरूरी है। अपनी जो अंदर भी बाकी भी मल्टीविटामिन होती है, B12 लेवल्स, ये भी अच्छी रखनी जरूरी है लोगों ने। और फिर बाद में अगर सपोज फिर भी अगर कोई वायरल इन्फेक्शन होते हैं, या क्या कारण है उसका, अगर रिपीटेडली अगर हो रहा है, तो मैंने जैसे कहा था कि अंडरलाइन क्या TH2 इन्फ्लेमेशन है, एलर्जी है, ये सही सलाह लेके। और कुछ रेयर डिसीजेस भी है कि जैसे इम्यूनोडेफिशिएंसी सिंड्रोम्स बोलते हैं हम, तो उसमें उसका भी प्रमाण बढ़ते जा रहा है आजकल, काफ़ी केसेस दिख रहे हैं और वो मिस हो जाते हैं, और रिपीटेड हायर एंटीबायोटिक लेके लोग उसे दबा देते हैं, और एक दिन पेशेंट बहुत सीरियस भी हो सकता है। तो इसीलिए कभी-कभी अच्छी डॉक्टर की, एक्सपर्ट की सलाह लेना भी बहुत ज़रूरी है। जैसे अभी हमने बात करते हुए किसी ने तो बोला था कि स्पुटम का कलर या नेज़ल डिस्चार्ज, तो कलर से बैक्टीरियल और वायरल इन्फेक्शन डिफरेंशिएट करना एक्चुअल साइंटिफिकली देखा गया है कि कोई भी ऐसा नहीं करना चाहिए। इट इज़ नॉट दैट ट्रू। जो लोग बोलते हैं कि हरा है मतलब बैक्टीरियल है, ऐसा नहीं है। वायरल इन्फेक्शन में भी हरा कलर या पीला कलर हो भी सकता है। सो इट ऑल डिपेंड्स ऑन द ईच एंड एवरी एरिया, एरिया वाइज भी होता है। काफ़ी बार हमने देखा है कि कोरोना में भी जो लोग जो है, कि दिल्ली का प्रिस्क्रिप्शन लेके यहाँ पे मेडिसिन ले रहे थे पूना में, तो उस तरह से लोगों ने नहीं करना चाहिए। कोई रिश्तेदार बोलेगा कि अरे तुम एक काम करो भाई, मुझे अजिथ्रोमाइसिन से फ़ायदा हुआ था, आप भी वो ले लो। इस तरह से लोगों ने नहीं करना चाहिए। उनकी ही बॉडी है, और 100 में से नहीं, एक बार भी अगर सीवियर इन्फेक्शन हो जाता है तो लोग जो है, जो भी कॉस्ट सेव करने का सोचते हैं, वो एक ही बार में उससे 10 गुना खर्चा करते हैं, और कॉम्प्लिकेशन होके उसके सीवियर इफेक्ट्स भी उन्हें भुगतने पड़ते हैं। तो उससे अच्छा तो बेस्ट वे, जैसे हम कार को बार बार रेगुलर सर्विसिंग करते हैं, मेंटेनेंस रखते हैं बॉडी को, तो उसी तरह से बॉडी की भी प्रॉपर सर्विसिंग और मेंटेनेंस करना उतनी ही जरूरी है, और सही तरीके से सही टाइम पे रिपेयरिंग भी करना बहुत जरूरी है।
जी सर, आज के इस सेशन के लिए बहुत बहुत धन्यवाद। वी आर वेरी वेरी थैंकफुल टू यू here at Dr. KK's Med Talks, and I thank all of my backstage people who work day in and day out for carrying out these sessions. I would request Batul right now to show us the certificate for you, which we have as a token of appreciation for you and the time spent here with us. Thank you so much for spending your valuable time here, sir. हम
थैंक यू।
आप सबसे दोबारा मिलेंगे एक नए एपिसोड, एक नए टॉपिक के साथ। तब तक के लिए जय हिंद और नमस्ते।